Recently, during my med-surg clinical at Aurora Medical Center in Grafton, I was taking care of a patient who at age 65 was diagnosed with stage 2 heart failure. Heart failure is when the heart is not able to adequately provide enough blood to the body for the tissues and organs in your body to function properly. Now at the age of 93, this patient has moved into stage 5 of heart failure, which means that she is experiencing signs and symptoms of a heart failure even while she is at rest. When the patient was first diagnosed with heart failure at the age of 65, she did not really understand her diagnosis, but she did realize that it was related to her history of hypertension, coronary artery disease, and also hypothyroidism. While the patient was also overweight, she never realized fully that her being overweight, combined with her history of illnesses, put her at a higher risk for developing heart failure and experiencing the symptoms that she was going to experience. Throughout the past 3 years, the patient had been experiencing a severity of symptoms which included fatigue, dyspnea, pitting edema, nocturia, and significant weight changes from the amount of fluid that was building up and then being taken off of her body with the medications that she's on. Coming up in the video, I will be describing these symptoms and how they can be experienced by a patient. Although heart failure can't be reversed, there are several medications that can be given to a patient to help them lessen the symptoms that they are experiencing. The first medication that my patient was on was Lasix. This is to help decrease the amount of fluid built up on the body. With excess fluid built up on the body, it can get very hard for them to breathe. It can also get hard for them to move around if they experience excess edema in their lower extremities. Another medication that she was on was losartan. This is going to help improve the blood flow to the tissues and organs in the body. So even if the heart is not pumping blood adequately, the body will still get enough blood flow to help your organs function. And within the last couple of days that the patient was in the hospital, because the doctors believed that she was nearing death, they had put her on a morphine drip so that some of the severity of her symptoms and the pain that these were causing would lessen while she was in the hospital, while she was nearing the end of her life. The patient stated that the medications that she was put on, she felt like they had just prolonged her death experience. And she knows that the medications did help relieve some of the pain that she was experiencing, but she did state that she wished that she could have decided when her life ended rather than her body deciding for her when her life would end. For education for this patient, we did talk about how we weren't really sure if she was going to make it out of the hospital, but she also said that some good education for her would be to give me advice that I could give to other patients that were in the same boat as her. So something that she talked about was the fatigue that she experiences at home, and the biggest thing that would have helped her is getting some type of motorized scooter or wheelchair to help her move around in her home. This helped for her, especially when she was experiencing an excess fluid buildup. If it was harder for her to breathe, and it was also harder for her to move around. She said that one of the biggest things that helped when it was installed was a chairlift to help her move up and down the small flights of stairs in her home. This is especially helpful to her when she needed to get to the bathroom quickly, if she did have a motorized scooter or wheelchair, so that she could get to the bathroom and go to the bathroom. So now I'm going to have some people who are going to tell you what signs and symptoms of heart failure are and how a patient can experience them differently and a good way to describe it to the patient.
So right now I would like to describe some symptoms to you. Just to try and help you understand the symptoms better, I would like to describe them to you before letting you know what they're called. Is that okay?
Yes.
Have you ever experienced a sense of being tired or unable to continue with activity after performing a simple task such as walking to the bathroom from your living room?
Yes, I have.
This is called fatigue. Have you ever had trouble breathing either while at rest or while performing simple activities?
Yes, I have.
This is called dyspnea. Have you ever noticed that your arms or legs are swelling and you pushing on them can cause an indentation in that part of your body?
Yes, I have.
This is called pitting edema. And last, have you ever had to wake up several times during the night to rush to the bathroom because you felt as if your bladder was full?
Yes, I have.
This is called nocturia. Thank you for spending this time with me, and I hope that my explanation of these symptoms will help you with any further symptoms you may need to discuss with your doctor.